Hey everybody, this is Chet Marko with Texas Family Health Plans, and it's time for us to give our annual address on what's going to happen this next year on healthcare. So we decided this year to do a video instead of sending you a written letter because different things that we've looked into says that 75% of the people will watch a video before they'll look at a letter. So what I want to do to start off is I want to kind of explain some of the things that are going on with healthcare. Like if you look over here on this map, right here, you'll see that I've got yellow, I've got pink, I've got green all throughout here. Well, the green counties are the counties that only have one carrier, and that carrier is Blue Cross Blue Shield. So in all those counties, all we have is Blue Cross Blue Shield. Now, in the yellow counties, we have Blue Cross Blue Shield plus one other company, but both Blue Cross and that other company are almost identical in premium. So there's really not much of a difference in those counties. There's not any savings. If you look at the pink counties here, there may be 2 or 3 carriers in those counties, but usually the second carrier in those counties is what we call an EPO. Okay, so you have PPO, HMO, and EPO. PPO has about 95% of all doctors in it. HMO has about 50% of all doctors in it. And EPO only has like 25% of all doctors in it. And a lot of people like, what's going on there? Well, one way you can ration healthcare is to minimize the amount of places that you can go to find coverage. So some of those EPOs, if your doctor is in it, it's good for you. If your doctor's not, or you need specialists, you may have a problem with some of those EPOs. So let's get into what I tried to do here was to make a board that talked about our main areas. We got Blue Cross, Ambetter, Christian Sharing, we use Altrua, and then Group Major Medical. And I'm going to go over and explain the strengths and weaknesses of each of them for this 2018 season. Well, a lot of people have been calling me, over the past, month or so with all the stuff in the news about Trump and healthcare and what's changing, what's not changing. Well, we know the Republicans failed to pass anything for healthcare. So, all this ran up to August. So all these insurance companies were sitting on pins and needles waiting for the government to make a decision, but they never could make a decision. So basically, the government's fiddling while healthcare burns. So all these guys at the last minute now are making all these decisions. We still don't know the prices, and here we are 2 weeks outside of open enrollment. But we do have some general ideas of what's going to happen, okay? So with Trump, just today, he came out and both Democrats and Republicans passed a law for the next 2 years that they're going to continue to pay subsidies, cost sharing. So really nothing's changing. Okay. Now, what Trump's long-term goals are here, I know what his goals are. What he's trying to get back to is underwritten health insurance for the healthy and risk pools for the people that have health issues. Risk pools have been very successful in Texas. In the past, they were funded completely by the state. But if we get federal money in on top of the state money, usually they're facilitated by somebody like Blue Cross Blue Shield. The risk pools could be a very affordable option, and then fully underwritten plans for people that are healthy could be a really good deal. So I kind of like the Republican plan. I think it can be a good deal for everybody. Okay, now let's talk about what's going on with Blue Cross right now. Okay, Blue Cross Blue Shield, individual health insurance, and I want to make a distinction between individual and group. Down here you have Group Major Medical, that's United Healthcare, that's Blue Cross, that's Humana, Aetna, Cigna, all those different companies. If you're in a green section, Blue Cross is the only company that is in every single county in Texas. Okay, a lot of the other companies have kind of cherry-picked their areas. But Blue Cross Blue Shield individual, which a lot of my clients will receive this video on, is an HMO. Okay. Now, I want to talk a little bit about what happened last year. Last year, rates went up 58%. All right, and all the United Healthcare, Cigna, Aetna, Humana all pulled out of Texas. So Blue Cross was one of the very few left. they had a 58% rate increase last year in 2017, which sent a lot of us tumbling. Well, we're getting around to this year, and with no changes made, they were looking at having to go up again a whole lot. But instead, what they decided to do was cancel their policies. Okay, they canceled their policies, and then they're going to automatically roll you to a new policy that is stripped down. Now, I'll go over some of the areas that those things are stripped down. So during open enrollment, you'll be automatically moved to something of comparable deductible and all that kind of stuff. There's just going to be a few changes to them to help them control the cost. One of the things that they're doing is they're raising the ER copay. The reason why they're doing that is they're trying to bring the price down. Too many people are going to the ER. They're instituting a 6-tier RX system instead of a 4-tier. Now, I'm sure that's not going to be very good. But what they're trying to do is they're trying to push people to use their PCP, and instead of going to the emergency room, they want them to go to urgent care, and they want them to use Teladoc. All those are good things, guys, and pretty much if you use those 3 things, you should be fine. Okay? One of the other things I want to point out is if you're moving like from Ambetter to Blue Cross Blue Shield, Blue Cross now is going to demand payment for that immediately. So you will have to, if your Ambetter runs all the way to the end of December, then they're going to expect you to pay that premium, the first premium for January and November. The other thing is if you canceled your policy mid-year, you have to back pay those premiums before you can sign up on January 1, that's going to be hairy. That's going to be real interesting to watch. Now, the other company we have is Ambetter. Now, Ambetter is an EPO. I talked about that earlier. 25% of the doctors are on it. And they're doing the same thing as Blue Cross. They're canceling their plans, and they're going to institute a stripped-down version. Now, one of the things that's changing with Ambetter is the hospital and the doctors in Kerrville are no longer taking it, but the hospitals and doctors in Fredericksburg are taking it. So that is one change. One thing for the better they changed is they added Methodist along with the Baptist hospitals down in San Antonio, so you have a little bigger selection in San Antonio. Okay, this is the Christian sharing. A lot of people are moving this way. It's not for everybody. If you have really bad chronic health issues or you're on a ton of medications, Christian sharing isn't for you. But if you just have a few health issues, a lot of people are moving to Christian sharing. Why are they moving to Christian sharing? For one, it's PPO. All right, so you have access to 95% of the doctors. The other thing, it is 40 to 50% of the cost of these guys. So if you can get it cheaper and you get a PPO, a lot of people are finding that very attractive. But you do have pre-X on Christian sharing, and you do go through underwriting. So you could have pre-existing conditions not covered for 2 years on some of those policies. Okay? But sometimes that's not a big deal. It ends up being a math question. They're experiencing huge growth right now. Now, they have had some growth issues, but like Altrua went from 500 phone calls to over 25,000 phone calls in a month. Okay, so I mean, that's pretty huge growth. So they've been really picking up their infrastructure, and I'm real excited about these guys because I think these guys are the future, at least for the near future. Okay, now, group major medical. If you want a PPO major medical, the only place you can get it is on group health insurance. Okay? To get a group health insurance, you have to have at least 2 people be on the policy, and you have to have at least 50% of the people in your company want the insurance. Okay? I've done a lot of husband and wife groups this year. If you do a husband and wife, you have to either both be K1 or the wife or the husband has to be a W-2 employee of the company. One person has to be a W-2 employee at least 30 hours. Okay, now, group has changed. Okay, you have no pre-X. You can sign up anytime you want, so you don't have to do it during the open enrollment. But your rates are based off of your county. So they take an average of the cost in your county, and that determines your rates now. So it's not just based off of one person or You know, a lot of times in the past, if you had a small group of 5 people and one person got cancer, then everybody's rates went through the roof, okay? Now it's based off of everybody in your county. But it is expensive, and if I had to take all these plans, the most expensive goes between Blue Cross, individual, and group, then comes Ambetter, then comes Altrua. Okay, so guys, feel free to call me and go over any of this. If you're watching this video, my name is Chet Marko. I'm the owner of Texas Family Health Plans. I've been an agent for 25 plus years, have about 3,000 clients, and we would love to help you. My personal phone number is 210-842-3026. That number again is 210-842-3026. Or you can find me on Facebook, or you can find me on my email. Okay, you can email me at chetmarko@gmail.com. Now, if you need to spell my name up here. Marko, and it's 210-842-3026. If you're one of Wayne Snelling's clients, Wayne, will you shoot out tell me your phone number real quick? Wayne Snelling?
Yeah, Wayne's number is
210-705
4936.
4936. All right, thank you guys. If you have any questions, do not hesitate to call me. We hope this video will be very informative for you. Thank you.